A CBS MoneyWatch investigation has found evidence to suggest that white Florida residents are more likely to receive the COVID-19 vaccine than the state's black population. Residents in communities with the highest white populations were 80% more likely to receive at least one shot of the vaccine, and the vaccination rate in high-income counties have nearly doubled the rate in low-income counties. CBS found that this is largely due to distribution policies. CBS MoneyWatch senior reporter Stephen Gandel collected that data, and he joins me now from Brooklyn, New York. Stephen, good to have you with us. So tell us, why are predominantly white and higher income communities in Florida getting access to the vaccine first?
Well, first of all, the access to health care is easier for whiter and wealthier communities. We have a healthcare infrastructure problem in this country, and that's playing out with the COVID-19 vaccinations too. The other thing is there's a technology divide, right? Most of the signing up for vaccines and the information about the vaccines is all happening online. So in communities that have worse internet access or they don't have as much technology resources, those communities are going to be more cut off. And then thirdly, unfortunately, there are some choices here going on. Like one place we looked at, Broward County, which has the largest black population in Florida, there are no pharmacy locations right now offering the coronavirus vaccine. And we asked the governor's office why this would be, and we got no response back. So we're not exactly sure why these choices are made, but the choices being made are leading to a distribution that hasn't been equitable.
Across the country, we know that communities of color have had a disproportionate impact from the coronavirus. Is that also, I assume that's also the case in Florida? And given that, is there a plan in place to vaccinate those communities who actually need it the most?
No, there's not. I mean, we looked at a number of different factors, and we found by far the factors that influence where the vaccine is being administered in Florida. Number one, the counties that are the whitest, they get an increasing share of the vaccine, and the counties that are the richest, they get an increasing share of the vaccine. Something like Miami-Dade County, which has had a 15% infection rate, far higher than the rest of the state, they are only being vaccinated at a rate of 3 to 4%. So we found no evidence that the state has looked at where the people have been impacted the most by coronavirus, have had the most amount of cases, and sending the vaccine there. That doesn't seem to be what's happening.
Stephen, Florida, obviously, when it comes to their demographics, skews older. And Florida was actually the first state to distribute vaccinations to residents 65 years old and older. How does age factor into the distribution of the vaccine in the Sunshine State?
Well, the reason Florida did this, and some other states are following suit, is because it simplifies the process. I mean, one of the problems of this vaccine rollout has been very complicated. Who's in what group? So just saying everyone 65 and older can get the vaccine, that makes it less complicated. The problem is that we're not the same, right? We know that Black Americans have more chronic illness. We know that Black Americans biologically are older than white Americans. And so the policy that if you get to 65, you can get a vaccine, but if you don't get there, you can't, that's going to disproportionately impact communities that have worse health outcomes, that tend to die at earlier ages. And unfortunately, in America, we've had this divide with healthcare outcomes, and that's playing out with the vaccine. So what experts told me is that we need to look at patients with chronic illness. We need to look at people that are in frontline workers' jobs. Those tend to be more Hispanics and Black Americans. And if we just say, okay, anyone over 65 can get the vaccine, then you have this negative outcome. It's not intended, but we get there anyway.
I'm wondering, Stephen, how much is this a Florida-specific problem based off of your research versus a nationwide problem?
Well, I think it's definitely a nationwide problem. I think that Florida has a more severe problem, at least right now, because they jumped to the 65 and older much quicker than some other states. But some other news organizations have looked at this. They found that generally this exists. It's worse in some states than other states. Florida was one of the states that was the divide was worse in. But, you know, it's not to be surprised. The government hasn't nearly done enough to overcome these inequities in healthcare to make the coronavirus vaccine be more equitable. And so it's not a surprise, and it didn't have to be inevitable, but the fact that we didn't do anything about it, it's come that way.
Stephen Gandel, thank you.